Have you ever heard of HPV or the vaccine Gardasil said to help prevent this virus? Do you know how bad the side effects are or what it's doing to these young girls that have been getting this vaccine? There are over 100 different kinds of HPV and it only protects against 4 of them. HPV is a sexually transmitted disease and it is common in nearly every person that is sexually active at some point in their lives. WebMD says that there are over 100 different types that they know of, and it only treats against 4. HPV is spread by vaginal, anal, or oral sex, and it can be spread even if someone does not know that they have this virus. Ways to prevent this virus are using condoms and being in a monogamous relationship. Listed on your pamphlets is some information about Gardasil, and it can be given to females from 9 to 6 years of age. It protects against anal cancer, cervical cancer, genital warts, vulvar and vaginal cancers. Also, precancerous lesions of the cervical area, vaginal, vulvar, and anal areas. Males can also get this vaccine from the ages of 9 to 26, and it will protect against anal cancer, genital warts, and precancerous lesions of the anal area. It is given in 3 doses, and the first dose is given whenever the doctor says it should be given. The second dose is 2 months after the first, and the third is 6 months after the first. Fainting can occur when getting this vaccine. So is this really a good thing to be putting into our bodies? The side effects of this vaccine are pain, headache, fever, nausea, dizziness, and vomiting. Also fainting. You should tell your healthcare provider if you have difficulty breathing, wheezing, hives, or a rash. These are side effects of this medication. Tell your doctor right away if you have swollen glands of the neck, armpit, groin, or joint pain, unusual tenderness, confusion, chills, and feeling unusually well, leg pain, or shortness of breath. Also, chest pain, aching muscles, muscle weakness, seizures, bad stomach aches, bleeding or bruising more easily, and skin infections. This really does not sound like a good thing to be putting into your body. According to the British Medical Journal, a teenage girl went into menopause at the age of 16. She stopped having her periods after the vaccine was given, and first they became irregular and eventually stopped. There were many tests done to diagnose this premature ovarian failure, and nothing came up that would have caused this genetically, just the Gardasil vaccine. The American Journal of Reproductive Immunology refers to Dr. Little's diagnosis that was referred to in the British Medical Journal. 3 other young girls also had the same symptoms of going into premature ovarian failure after receiving the Gardasil vaccine. They all were normal before they got this vaccine. The 3 experienced nausea, headaches, sleep disturbances, and a range of cognitive and psychiatric disturbances. HPV has also triggered an autoimmune disorder. Do we really know enough about this vaccine? Should we be giving this to kids that we care about? Or do parents, should they just wait until the kid can make their own decision and know why they're getting this vaccine and what it is for and what it is treating?